Much of the dentistry that is practiced today comes from the 50s and the 60s. It was drill, fill, and bill, and that was what was done.
It's a huge paradigm shift for a lot of dentists.
Right now, I think in the movement in biomimetic dentistry, we're disciples.
We're trying to influence the students early on in dental schools.
It's stuff that I kind of came out of school with. I think that the concept of it is super fascinating, and it's something that I'm going to be using for the rest of my career, you know?
And really, it's what many of us have been doing all along, and it's just now being ramped up to a new level. It gets really exciting because I think we're going to see a huge change in the future.
This isn't a course in office practice or office management. This is a course in hands-on how to treat very difficult situations. Proven, which can be taken to the laboratory and done over and over again. And it isn't based on, well, in my opinion, this is good, or in my hands, these materials do certain things, or at our school or in our office, these seem to work. No, these things are reviewed by everyone worldwide. There are many good materials, but the best of the best is what we get out of the course.
I'm learning a ton of new things at this course. There's time increments that are involved as far as the time-sensitive techniques. There's material-sensitive techniques based upon research. I think that's the biggest thing, that exposure to the research.
If you ever think you know it all, you'll always get a shock. And what it does is it helps us to sort of re-look at what we're doing and add to it continually. Did I learn something today? Oh, absolutely. Much of the materials that were spoken about, of course, I'm familiar with and use all the time, but certain ways to use them reinforced opinions that I'd had. David has done an absolutely huge review of the literature that's out there to back this all up scientifically. Is it a change in my thought process? Absolutely.
It will change the way you practice dentistry forever, but for the good. There'll be things here about tooth-conserving dentistry that will make your life simpler, easier, more satisfying. No sensitivity to your teeth. I mean, that was a big thing for all dentists, is sensitivity. It'll end it.
The more tooth structure we keep and we leave in place, the better off we are. There's no better material than tooth structure itself. So the preservation of that has always been a goal for many of us for a long time. And does it benefit the patients? Well, absolutely, because it leaves us more tooth structure later on when we need it, should we need it.
Okay, there's lots of things that we can do to change their bite, but in a minimally invasive way with adhesion. And if you understand those principles, it's very easy to do. Obviously, we see patients at all economic levels. And there are some people that come in that say, Doc, I can't afford a crown. What can I do? Well, we give them biomimetic dentistry, knowing that later on that they can jump to the next level to restore that tooth properly, but know that that level that can last for a fairly long period of time.
Just know that we're reducing root canals by 75%. That's a lot of savings for insurance companies. So the dentists need to charge more for the kinds of quality restorations we're providing. They're non-invasive, they don't hurt to the patient, we're not cutting the tooth down, they won't need more dentistry later, and in a way it's like the evolution of chiropractic. So the chiropractors wanted you back every week for years and years and years, and now they've got techniques to make you better and well, and that's what we're doing with the mouth.
Some people have dedicated their whole lives to just elucidating one or two little technique things that are so important, and we're not exposed to that once we get out of dental school. So this is a great way to add more skills and more treatment modalities to your armamentarium. It gives you more you can do to do more good for your patients more of the time. The profit centers in the industry rotate around crowns. Everything that has to do with the crown, the posts in root canal treated teeth that need crowns, the crowns themselves, the buildups under crowns, all those things were a big part of the practice until we got involved with all of these things. We do very, very few crowns in my practice. I bet it isn't one a week that we do now. But we've had a lot of success doing the minimally invasive things, the early diagnosis things, the biomimetic things, and our patients are a lot happier. When they come in for an exam and a cleaning, you know, the every 6 months thing that you had to do when you were a kid, and the patients drop into the chair, they're smiling and they're happy. And we look as hard as we can And for the most part, if they've been in the practice for 2 or 3 years, we can't find anything that would even come close to needing any kind of restoration. My name is Michael Haney. I practice here in the Salt Lake Valley, and I'm a biomimetic dentist.
Michael.
Hi, I'm Georgine Chase. I'm a dentist in Reno, Nevada, and I'm a biomimetic dentist.
Hi, my name is Dr. Gene Allen. I'm from Prescott, Arizona, and I'm a biomimetic dentist.
My name is Justin Libby. I practice in Salt Lake City, Utah, and I'm a biomimetic dentist.
Young, I practice near Loma Linda University in San Bernardino, and I live in Riverside, and I've been doing biomimetic dentistry, I suppose without understanding the name, since 1985. I am a biomimetic dentist for certain.